Thank you so much for joining us. My name is Berta. I'll be your host. I'm the Secretary to the Mayor's Office of Housing here at the City and County of Honolulu. All right, thank you so much for joining us today. Just so that everyone's aware, this is panel B5, Managing Success, Coordinated Entry, Case Conferencing, and the Built for Zero approach. Hopefully you joined the correct panel. If you are in the wrong panel, there is a link available in the chat room that will take you back to the main page where all the other panels are available. Okay, today I am happy to introduce our three panelists today. So we have Nate, who is the portfolio lead with Community Solutions. He works directly with communities to build and improve systems to end homelessness. Next, we have Morgan. She is the CES team lead with Partners in Care. She works to connect the most vulnerable homeless clients with the scarce resources available within the local continuum of care. And then last but not least, we have Lindsey. She is a CES specialist with the VA Homeless Veterans Program. She represents the VA in leading efforts to end veteran homelessness with the community alongside the Continuum of Care, which is Partners in Care. Just so that everyone is aware, we are recording our session, so we will hopefully have this available in the near future to look back on. We will also have their PowerPoint presentation available on our webpage at a later time as well. Everybody is muted. Everybody's video is also off, just so that we can avoid any technical difficulties. There is a Q&A available on the right side of your screen near the bottom. Feel free to ask any questions there, and I will go ahead and assist in reading them out to our panelists at the end of the session. All right, and so here we go. We are going to start. We can go ahead, Nate. Thank you.
Right. Hi, everybody. Great to be here with you. Like Berta said, thanks for the introduction, Berta. I'm with Community Solutions and Built for Zero, which is our initiative to end homelessness in the United States and really around the world. We're in several other countries that are running similar kinds of initiatives. And here in the US, we have almost over now 90 cities and communities and regions. Honolulu being one of them has been with us for, all of you have been working with us now for more than 5 years. Started the previous iteration of this initiative. And it's really, I get a sense that this is really starting to become a movement. People that are the people in these communities who are the people that believe that ending homelessness is possible and something that they want to do that's a goal worth working towards. And that group is growing larger by the month now as we continue to move forward. So it's exciting to see all those communities that are part of this network. And, in so many ways, we're trying to create a network here that people are connecting to each other through and learning from each other about the things that are inevitably shared challenges across all of these cities and regions and communities. And I just want to note that even though I was thinking today, there's really no other, I was thinking, what's a comparable city to Honolulu? And there really isn't, I would say, a great comparable city to Honolulu in the mainland US, having been there many times to work with all of you. But I think that the lessons, that the principles that become known through this work are really widely applicable. And so anyway, I think you're in good company there in being part of this network. So I wanted to just talk a little bit about our approach. For those of you that are less familiar, again, we really focus on ending veteran homelessness, ending chronic homelessness, and eventually all homelessness. We now have a cohort of communities working to end all homelessness as their next goal. And regardless of where a community is at in that progress, in that progression of ending homelessness, these things remain true as part of our approach that we think are good ideas and have proven to be effective so far. So first and foremost, that the work is locally driven. We don't pretend that we can come up with some discrete set of technical solutions that you can just do the same thing everywhere and get this result. It must be locally driven, but more importantly, it must be bound up in the local wisdom the community. Nobody is an expert more than the people that are actually working in a system, in a community, about what the challenges are, about what solutions will work. And so we really take a bottom-up approach, I think, so to speak, in our national work, in that we believe in starting with a local team who is actively figuring out the path forward, problem solving. We teach proven problem solving methods. You'll hear us talk a lot about quality improvement and improvement science, data analytics, human-centered design, and facilitation for results. And those are capacities and capabilities that, as a person myself working in the homelessness sector, I had never used or been taught before. And so we know some people already know these things, but for others, these are newer things to learn and newer kinds of skills that we're really kind of learning together and using as a way to do applied science in the way that we end homelessness. And of course, as part of all of that, we're data driven and really believe. I'm wearing my data shirt here says it's pronounced data, which is a pun because some people call it data. So we're very data people, and we think data is one of the things that helps cut through the complexity of homelessness, and that having real-time data is really critical to being able to make the kinds of ongoing decisions and pinpointing the problems that need to get solved and so on and so forth. We believe in collective impact, that there is no one leader in any community that by themselves can solve this problem. I've yet to see that be true, that it always requires a collection of people, and not just a group of people from the same sector, but across sectors, really bringing their unique perspective, and maybe more importantly, their unique strengths and assets and resources. And I don't just mean funding and bricks and mortar housing, but just their own knowledge and what they know about the issue from their own perspective, and creating a solution that needs to get implemented. So those solutions are always better if they are born out of a multi-sector, multidisciplinary group that are designing those things as they go. And the buzzword is collective impact. And I like to say that lots of people talk about collective impact, but Built for Zero communities do collective impact, and that you all do this more than we talk about it, which I really appreciate. And then last, like I mentioned earlier, the power of peer-to-peer learning, that when you're discovering a breakthrough in your work in Honolulu, that's not a secret, that a leader or a group of leaders in Wisconsin who are also working on a similar problem could easily access the knowledge that you're creating through your work and the lessons that you're learning, that those can be shared as quickly as possible, or we don't have to wait for an annual conference for you to learn that we find faster ways to connect people together and make that cross-peer learning really flow. Okay, so that's something about our approach. And, I just will say, I like this line that I'll say Lindsey pulled in here about that getting to zero takes moral courage. And it really does, because it's so against the grain of what is a commonly held belief, which is that homelessness is an unsolvable problem. That's the most commonly held belief. And by taking on the goal of ending homelessness, you're resisting that common perspective and saying, no, I think we can do that. And that does take courage, and it does take moral courage. We think that resources are never the full answer, that just a housing program on its own can't solve this problem, but it really takes a whole system that must have a systems approach. And that really, when we talk about systems, there's systems of systems, right? It's a larger system containing smaller systems that all need to start working together in coordination in order to be successful, and that those systems cannot stay static. There is, this needs to be an infrastructure that's stood up like an emergency response infrastructure that can continue to evolve over time easily and quickly, and be able to change with the changing needs and times and the changing environment, as we're all experiencing now with COVID. Who would have predicted that this is what we would be, the place we would be in as a country in January of this year? So we never know what's going to happen, and the system has to be malleable and bendable and able to shift and continue to grow and evolve, not just to respond to challenges like that, but also to continue to morph itself around the next challenge and what it needs to become. And so my last slide here is just about systems, and this is sort of a bridge to hand it off to one of my colleagues here. The importance of systems, and that we think in terms of systems. And I just created this little definition. I think it's sometimes important to understand that systems, as we start to think about them, or we think about them in the homelessness work we do, is about a dynamic interaction of processes. It's not a set, it's not a prescribed flow of things that are always happening in sequence. Things are changing, that there's a combination of processes and structures, there's policies, there's coordinated entry policies, there's other policies that are at work, there's a resource map, there are human relationships between people serving, people experiencing homelessness, between people that work at different agencies, and values. And all of those things together hopefully are moving towards a shared goal. And that really is, that whole collection of things are your system. And as Edward Deming says in my quote here at the top, he's the father of quality improvement. Every system is perfectly designed to get the results that it gets. And so what that means to me is the outcomes we get right now are a product of our current system. If we want to get better outcomes, we have to change the system. That's the way to get there. So I'll stop there and hand it off to who's next.
Great, thank you, Nate. So my name is Morgan Essery with Partners in Care. I'm going to give a little bit of some background introduction to Partners in Care. That's the island of Oahu's local continuum of care and some of the systems that Partners in Care leads. So to give a little bit of background, as I mentioned, Partners in Care is Oahu's continuum of care, and a continuum of care, it's a regional or local planning body that coordinates housing services funding for homeless families and individuals within a designated area. So I think since 1994, I believe, HUD's required for communities to work together in submitting applications for funding rather than having individual agencies submitting funding to HUD, the Department of Housing and Urban Development, with the intent to create a structure that would stimulate community-wide planning and coordination of programs. So to really operate more as a system, as a continuum of homeless service providers. And so Partners in Care is a coalition comprised of nonprofit homeless providers, of government stakeholders, private businesses, community advocates, hospitals, universities, law enforcement, and persons experiencing homelessness and with lived experience. And so just to share a few of our objectives, they are to engage in planning and evaluation to maximize existing resources that we have within our continuum now. Partners in Care seeks to advocate for policies and policy change to promote a comprehensive and long-term approach to solving homelessness, as well as to work collaboratively with other agencies and groups across the island of Oahu and the state of Hawaii. So you can go to the next slide, Lindsay. I want to talk a little bit about the point in time count. Some of you may be familiar with the point in time count, some of you may not be. Just want to give a general overview of what the point in time count is. So this is a requirement by HUD for all continuums across the country to conduct a count of sheltered and unsheltered homeless persons on a single night in January. The point in time count this year was completed on Thursday, the January 23rd, from 4 a.m. to 11 a.m. So I just wanted to go over a few parts as it relates to veterans as to what some of the findings were from the point in time count this year. And just as a disclaimer, all of this can be found, there's a veterans sub-report of the point in time count, as well as the full point in time count report can be found on the Partners in Care website. So a total of 4,448 individuals were surveyed during the point in time count this past year. 356 of those indicated that they were veterans. So that's about 10% of the adult population that was surveyed. And for the purposes of what we're discussing, a veteran is defined as a person who served in the U.S. Armed Forces, Reserves, or National Guard. So to look at this here, so I mentioned 356 veterans. The chart to the bottom left shows the number of sheltered veterans and unsheltered veterans. So 59% of veterans, 210 individuals were sheltered, and 41% were unsheltered, 146 individuals. And if you look at that chart to the bottom right, this shows that the total veteran population from 2019 to 2020 decreased by 7%. The number of unsheltered veterans decreased by 28%, and sheltered veterans increased by 16%. So this shows that people are moving from being unsheltered to being sheltered, and our total veteran count is going down. So you're really seeing that system flow and how veterans are moving through the system, which I think leads into the ways that we're doing this. So how are we creating this system flow? So one of the components, I'll talk a little bit about coordinated entry. I want to give some background as to what coordinated entry is. Talk a little bit about VI SPDATs, HMIS, and then we'll pass it off to Lindsey. So coordinated entry, HUD requires every COC, similar to point in time, requires them to establish and operate a centralized or coordinated assessment system known as coordinated entry system. You'll hear the acronym CES a lot. And so coordinated entry has the goal of increasing the efficiency of our local crisis response systems and improving the fairness and ease of access to available resources within our continuum. So coordinated entry processes, it's intended to help communities prioritize those most in need of assistance for the scarce resources that are available. And so this provides information to COCs, continuums of care, such as partners in care and other stakeholders, about service needs and then gaps within the system to help us strategically allocate our current resources as well as identify the need for additional resources. And so CES began on Oahu with a soft launch around August 2017. So it's about 3 years old now, still very new. And so CES really aims to allow users to CES partners for our partners in care to efficiently and effectively connect people to the interventions that are aimed to rapidly resolve their housing crisis. So can you go to the next slide, Lindsey? The goal with doing this is changing from a system here on the left where you see it says without CES and becoming a system that looks more like what you see on the right here. So on the left, without CES, all these dots at the bottom, question marks and exclamation points, are homeless families and individuals in crisis and a housing crisis navigating our crisis response system, our homeless response system. And so that can be very challenging. It's even with the system we have in place, it's challenging to navigate the system. There's so many resources. And so what does the client need at this point in time, and how do we get them to the resources that would most appropriately and effectively end their housing crisis? So with coordinated entry, the idea is that clients and providers would not need to navigate this maze, but we can centralize our understanding and knowledge about the resources available in our continuum and focus on very specific access points. You see at the bottom of this chart on the right where it says assess. So having specific access points where clients in a housing crisis can be uniformly assessed using a standardized assessment. And then towards the top of this graph, you'll see this blue, orange, and green house. So there's specific housing resources that coordinated entry matches and refers clients to, such as permanent supportive housing, such as rapid rehousing, transitional housing. So coordinated entry's goal, as I've mentioned, is to try to navigate clients from access point, from housing crisis to the appropriate resource based on a prioritization criteria. So based on partners in care, and when I say partners in care in this sense, I don't mean the agency and the staff ourselves, but partners in care, the entire continuum. So all of our homeless service providers, law enforcement, those with lived experience, everyone that I mentioned before, coming together to decide what is the priority within our continuum in terms of referring clients to appropriate resources. And so CES has to follow this prioritization matrix in order to best match and refer clients to resources as they become available. And in order to do this, you can go ahead to the next slide, Lindsey. We have providers complete, so the assessment, have providers complete a standardized assessment tool. This is known as the VI SPDAT. That stands for Vulnerability Index and Service Prioritization Decision Assistance Tool. It's a mouthful, so we call it the VI SPDAT or the VI. It's a triage tool that assists in informing appropriate housing pathways based on a person's acuity in several core areas, such as history of housing and homelessness, risk factors, socialization, daily functioning, and wellness, to include physical health, substance abuse, mental health, things like that. So Partners in Care has implemented the VI SPDAP for single adults, for families, for transition age youth, or TAY. So that's individuals 18 to 24 in age. And we use this for veterans. So people are assessed with this. Everyone is assessed with a standardized assessment tool. And then based on a few components, it's chronicity, so how long someone's been homeless. They receive a score from this assessment, and then the quantity of disabling conditions a person has. We've come up with a matrix to say, okay, this is how we're going to prioritize people for housing resources based on these three components. And so once a client or family receives a VI SPDAT, they're entered into the HMIS system, where they may already have a profile, that client, in HMIS, the Homeless Management Information System. They receive an assessment, and by putting that assessment into HMIS, that client is added to what's called the by name list. And so if you want to jump to the next slide, Lindsey, the by name list, it's essentially like a real-time roster of homeless individuals and families presenting for in need of homeless services and resources. It's essentially, in a way, I mean, you could consider it like a point-in-time count. It's a live point-in-time count that could be generated every day, every hour. It's updated in real time. And so this by name list should include all veterans, all individuals or families who are presenting in need of homeless assistance. And it helps to understand the scope of homelessness in our community. So for veterans specifically, how many veterans are currently homeless in our community? How many veterans are chronically homeless in our community? How many have been homeless for the longest period of time? It helps us to understand how many people are moving in and out of the system on an ongoing basis. So how many new assessments are being completed, say every month, and how many assessments are being exited? Are those exits to permanent housing? And this gives us information as to system flow, so that we can then set goals in order to reduce homelessness. So we can look at what are our current numbers in terms of veterans homelessness, and what are our goals, and how can we drive those numbers down to really effectively end veteran homelessness. So the by name list can be very informative, is very informative as to where we're at now, where we're operating at now as a system, and where we have to go. And so one last component I just wanted to highlight in terms of coordinated entry. I've kind of gone over what coordinated entry is, how clients are, people are coming into this coordinated entry system through the HMIS, and then being referred to housing resources and assistance. One other component to effectively appropriately matching clients with housing resources is through case conferencing. So case conferencing is, for veterans specifically, it's a bi-monthly meeting of outreach teams, housing programs, case managers, program leads, all of those working with a homeless veteran to focus on the chronically homeless veterans, the most vulnerable veterans. It's a meeting, a collaborative meeting of all veteran service providers coming to the table to discuss barriers, systems barriers, individual barriers with the client. There's so much more that we can get done when we all come to the table together and build off of each other's experience than resolving someone's housing crisis by ourselves. So case conferencing has been very helpful in terms of discussing the most vulnerable veterans, what our goals are as a continuum for serving these veterans. And so just to give a few goals of what case conferencing is. So it's a routine, centralized process, helps to monitor and advance various people towards housing. And then the goals of case conferencing are really to, like I mentioned, identify and track systemic barriers and strategize solutions across multiple providers. Another goal is to clarify roles and responsibilities to reduce the duplication of services. Everyone's time is so incredibly valuable, and there are many more people in need of assistance than there are homeless resources at any point in time, typically. So ensuring that our resources are used most efficiently, that we can ensure that, okay, one person is really navigating this client through the homeless crisis response system, then that can alleviate any kind of duplication and use everyone's time as efficiently as possible. And then the last piece, to ensure effective client navigation of the CES system. So coordinated entry can be used in case conferencing to ensure that veterans who are on a specific housing pathway that's the most appropriate housing pathway for them. And if it's not, then we can discuss that at case conferencing and try to overcome any barriers we may be facing. And I think with that, I'll go ahead and pass it off to Lindsey.
Thanks, Morgan. Okay. So that leads us into our Mayor's Challenge to End Veteran Homelessness. This is kind of our driver to end veteran homelessness. So the Mayor's Challenge to End Veteran Homelessness is an interagency initiative that launched in 2014. And basically, communities are committing to ending and preventing homelessness among veterans in their communities. So Mayor Kirk Caldwell signed on to this initiative. And as far as aligning efforts, twice a month we meet, we have stakeholders and community providers from the mayor's office, state homeless office, outreach workers, case managers. And with assistance from BFZ, we've been able to set goals and decide on actions and required steps to kind of work towards ending veteran homelessness. And through this initiative, we implement change ideas to help do this. So what is our overall goal? So we want to end veteran homelessness. So the way we like to talk about that is reaching functional zero. So a community has ended veteran homelessness when the number of veterans experiencing homelessness is less than the number of veterans a community has proven it can house in a routine month. So however many veterans are coming onto the by name list is basically equaling how many veterans are being housed and coming off the by name list. And then a community has ended chronic homelessness when the number of people experiencing chronic homelessness is 0. Or if not 0, 3 or 0.1% of a point in time count number is how we reach functional zero. And the goal is to put ourselves out of a job. So some of the current change ideas and efforts we're working with as part of the Mayor's Challenge and Built for Zero initiatives. We're trying to decrease chronic homelessness by 50%. And we've been diligently working on this goal. So as of last year, we had about 123 chronically homeless veterans on the by name list. And we've been able to work towards 63, or we're working towards the goal of 63 chronically homeless veterans. The other change idea that we're working on is improving our case conferencing. As Morgan noted and Nate noted, this is a system and we have to continue to adapt and change and just work with the community on what's needed and all of that. So as far as decreasing chronic homelessness for veterans, at the beginning, we only had one veteran-specific case conferencing. So we added a second one to focus on chronic homeless veterans. And through those case conferencing and our Mayor's Challenge, we've been trying to identify gaps in resources for veterans, for chronically homeless veterans. And then additionally, CES prioritization. So chronic homeless veterans are prioritized for housing resources first before non-chronic homeless veterans. So as far as improving case conferencing, again, it's a continuous improvement and adaptation based on the community and provider needs. And with the assistance of BFZ, we've worked a lot on case conferencing. We've learned to decrease time spent on introductions and announcements and made our meetings more action-based. So we'll go through the by name list and try to figure out what's a barrier or, you know, what we can do to support a veteran and what's the next step. And then we had to figure out who was responsible for navigating that veteran to that next step. So as you can see on this chart here, this is some of our current progress based on our by name list. So as of January, we had 278 veterans on the by name list. And as of August, we were down to 217. And for chronically homeless veterans, in January, we had 104, and we've been able to decrease that to 71 chronically homeless veterans. So we're close to our goal of 63 as of last year when we were trying to decrease by 50%. So Morgan talked a little bit about the by name list, but as far as the by name list, it has to have quality data. You know, this is a real-time list of veterans that are currently experiencing homelessness, and so we need it to be accurate. And you know, the key components of a quality by name list are ensuring that the system is touching everyone who's homeless in the community. So we want every homeless veteran to be on this list. We want to be able to track who's coming into the system, who's going out of the system. And we also want to see if what we're doing is actually working. You know, are the things that we're doing in case conferencing increasing the number of veterans that we're housing each month? So quality data is very important, and we've come a long way since CES started. Everyone, I believe, can agree. And we're just continuing to work on the data and the by name list, and yeah. So some of the challenges we've had at CES. So it's important for everybody that works with veterans in the community to be at the table. We want, you know, representation from all different disciplines. Some providers have been reluctant to come to the table. Some providers haven't received adequate or any training in HMIS or CES. But I want to just say that PIC and HMIS have been doing a great job on training in recent year, and they've created a great curriculum, so that's definitely improved. Another challenge is the large number of homeless veterans on the by name list, as well as locating and contacting the veteran. So when a veteran comes up on the list and gets referred for a resource, we often can't locate them, or their phone has been disconnected, as well as coordination of navigation services. So when somebody gets referred to a housing resource, who's helping them gather all their documents and submit all the required forms and documents? And also, not all veterans are eligible for veteran resources. So as far as some resources, they have to be VHA eligible, and some veterans that have not served active duty time aren't always eligible for the same resource. Additionally, there's not always enough housing resource in that aspect. There's some gap populations that we just don't have resources for. There's veterans that cannot live independently and require a higher level of care and more support than any resources can provide. And then obviously the most recent challenge is COVID-19. This has kind of thrown a wrench in the plan, but luckily we've kind of adapted, and all of our case conferencing have been virtual, conference calls, Zoom, Google, all of that. So we've managed to adapt, and we're continuing to make progress in spite of COVID-19. So what are some of our successes? So veteran validations. So when a veteran is entered into HMIS and appears on the by name list, VA staff are able to see this list, and we look up in our databases and verify what resources they're eligible based on their service time and discharge status. So we're able to do that prior to them getting referred to resources, which helps us streamline them to the appropriate resource and saves a lot of time and expedites the housing process. As far as diversion, so we've done some diversion trainings in our homeless provider community. And basically diversion is preventing someone from even becoming homeless. And that could just be a conversation or asking some questions and, you know, finding a different housing arrangement or solution rather than them entering homelessness. So as you saw in that chart earlier, we've decreased veteran homelessness by more than 20% from January 2020. And we've also decreased chronic veteran homelessness by more than 30% from January 2020. Additionally, we have quite a few HUD-VASH vouchers for VHA eligible veterans, which is very fortunate. And so at some point, we're going to have everyone assessed that's eligible for a HUD-VASH voucher. One of the other great things, so the veteran population is very fortunate because the VA has federal funds available to fund full-time CES specialist positions, so which is what my position is. And so my time is dedicated to helping to manage the by name list, collaborate with all the stakeholders and providers, to working towards ending veteran homelessness. So it's pretty lucky that my position is here. I'm able to do a lot of things that other people wouldn't have had time to do. All right. So some of our future priorities. So as we work to put ourselves out of a job and end veteran homelessness, we want to strengthen our diversion, coordinated entry, and focus on prevention, because we don't want anybody to fall into homelessness. And if they do, we want it to be brief and one time. We want to increase our exits to permanent housing, and of course, make data-driven decisions. We want to educate others. As Nate said, we want to share and disseminate any best practices or things that work or don't work in our community so we can help each other out. And then again, advocate with a collective voice. These veterans are all of our veterans. They're not the VA's veterans, they're not US Vets veterans, they're Hawaii's veterans, they're Oahu's veterans. So we need to work together to end veteran and chronic homelessness altogether. So I'm going to pass that on to Nate. Thank you very much.
Yeah, so I think I just want to raise this provocation about ending homelessness. And, you know, one of the things that we've noticed in other communities is that there's a really direct correlation to the depth of belief in ending homelessness, that that's possible, the degree to which a core group of people believe that that goal is possible and commit to getting there together is instrumental in being able to get there. You know, there's this story of the 4-minute mile that you may know, that no one had ever run a mile in faster than 4 minutes. And no one ever did until one day somebody did. They broke the 4-minute mile. And then the next year, 2 other people broke the 4-minute mile. And just simply the act of doing it convinced other people it was possible and made it possible. So I just want to invite those of you that are watching that are maybe more on the periphery of this conversation or learning about some of these things for the first time, to really come towards the group here, the team here that's working towards this goal. And it's a worthy goal to try to reach. And yeah, you're already on your way. So that's it. Yeah.
Thank you so much to our panelists. We do have, oh good, they provided their contact info. And then I will go ahead and I'll input my email into the chat room. If anybody wants to connect with our panelists and they weren't able to get their emails, feel free to reach out to me. We do have one question, Nate, it's for you. So I'm gonna ask it for you because I know you have to run to do our closing plenary. Our question is, given the pandemic, what are the challenges and how relevant is Built for Zero?
You know, I think the challenges you all are fairly familiar with. You know, they are about how to keep staff safe and continuing to support people that are experiencing homelessness, how to convert processes that had already been sort of stood up and working into virtual versions of that. I think the obvious problem of people experiencing homelessness have nowhere to shelter, to be quarantined and isolated. So as we all moved inside and started working from home, it just left everybody else out there. And so with all of those challenges, I have to say, I'm really find that the way that communities have responded, and Honolulu included, to be remarkable, in that they adapted quickly, the states and the federal government invested resources to stand up those quarantine and isolation spaces, and that people didn't stop. You know, things slowed down, housing processes slowed down, but people didn't stop, and people still aren't stopping. And I think that, you know, in our minds at Community Solutions, this has really elevated homelessness to become seen as a public health issue, that we should see ending homelessness as a charge of public health. It is for the sake of people experiencing homelessness, but it's for the sake of everyone in the community as we're trying to mitigate spread. And so everybody wins the more that we end homelessness. And so in that sense, I find Built for Zero and the notion of ending homelessness more relevant than ever. And I think this is, you know, I really do believe that this is presenting a new opportunity to get there faster because of the level of federal investment that's out there.
Thank you so much, Nate. We understand if you have to run and prepare for the closing plenary, so we're going to go ahead and let Nate go. Thank you so much for your time. We will keep Lindsey and Morgan for just a couple minutes. We do have another question from an attendee. So the question is, are there new implementations to support more veterans, including those that may not qualify due to time in service or other honorable general discharges in response to COVID-19? So are there new implementations to support veterans in response to COVID-19?
Morgan, I don't know if you want to speak up, but I also want to say that the veteran by name list is a subset of the individual and family by name list of the general population. So if a veteran's not eligible for a veteran resource, they can also be referred to any other resource in the community. It's not specific to the veteran. It's just based on their vulnerability and who needs it the most. So I'm not sure if Morgan wants to mention anything on COVID funds. I know there's been some ESG funds, but I'm not quite familiar.
Yeah, I don't have a lot of information on the COVID funds at this time, but I know that there's still additional resources in coming down the pipeline for our community in general. So, but just to echo what Lindsey said is that yes, there's veterans, if they can be served with veterans resources, as she mentioned, HUD-VASH has more resources than veterans, so eventually we'll get to that point. But veterans as well are eligible for all other services across the continuum.
Thank you so much. All right, so that's all the time we have for questions. If you do have further questions, feel free to email me or our panelists. My email is available in the chat. After this session closes, we do have our closing plenary and our mahalo for the conference. So after you close out this chat, I have the link also available in the chat that will lead you back to the page to join the next panel if you want to participate. All right, thank you so much. This video as well as the PowerPoint will be available on the same link on the Office of Housing page in the near future. Thank you so much for everybody who joined us. Have a good day.
Thank you, guys.
Thank you, Morgan. Thank you, Lindsey.